Health conditions related to your kidneys are sharply on the rise. And this isn't good because your kidneys are really important for your overall health. Many medical institutions will say, we don't know why this is happening, but I'm going to share with you exactly why in this video as we talk about the early signs and symptoms to watch out for, but most importantly, how to prevent these issues and the solutions that you need to know. Hey Wellness Warrior, it is a pleasure to see you again. And let me tell you, your kidneys are incredible. They're the most complex filtering system that exists on this planet, and they are responsible for keeping you healthy and functioning at this very moment. Let's take a look at a few things that they're doing to keep you alive right now. First of all, they're helping maintain proper fluid balance throughout the body. So how much water do we retain? How much do we expel? Well, that is for a good, healthy, functioning kidney to figure out. You don't even have to think about it. Next, regulating minerals. How much sodium, how much potassium. Your kidneys will decide how much to get rid of and how much to maintain. They also are going to remove waste for you. Now, waste comes in a lot of ways. We're going to have waste from the food that we're eating. We're also going to have toxins that are just in our everyday lifestyle. I mean, it's such a burden on our bodies anymore because we have detoxification organs. That's our liver, that's our kidneys, those are our lungs. But the problem is there's so many toxins that we're encountering through our just day-to-day life that it's a huge burden on them. And then of course there's medications, which is just a disaster today. And we'll talk more about that in just one moment. Next, they're going to help create hormones, okay? Hormones that help regulate your blood pressure, keep your bones healthy, and also produce red blood cells. Now let's take a look at some of the signs and symptoms that may indicate you have toxic kidneys. Now, as we look at signs and symptoms of any condition, it's very important that we remember that we take a reasonable approach, right? There's going to be minor symptoms and more severe ones. The minor ones, if we have multiple compounding minor symptoms, then we want to start getting our wheels turning thinking, hey, if this all leads towards kidney issues, we want to do something about it. And some of the more severe ones, I'll point them out along the way. You're going to want to call your doctor right away. Now, the first on our list is going to be poor sleep. If you're someone who just can never catch a break and get good sleep, then you're going to want to get your wheels turning that, hey, maybe I potentially have a kidney problem because I can't figure out why I can't sleep at night. And then, of course, there's fatigue. And we know that poor sleep causes fatigue, but chronic fatigue also comes from unhealthy kidneys. You get a buildup of urea in the body that just strips you of your energy. Now, also we have a decrease in concentration. Now, this happens from a couple reasons. You'll get a decreased production of red blood cells, which means less oxygen to the brain, but also you get a heavier toxic load in the body, meaning that, well, due to all the toxicity that you experience day to day, it's building up and it's creating more brain fog and your brain is just not gonna work right. Metallic taste in your mouth. This happens due to uremia. So if you see that the changes in flavor with your food or maybe that metallic taste, another thing to pay attention to, dry and itchy skin. So if you're someone who has chronic dry skin, it just doesn't ever clear up and it itches all the time, that also can be due to unhealthy kidneys. We're gonna see urine changes, and this happens in a lot of ways, okay? So we can see urine changes in the way that whenever you go to the bathroom, there's a lot of foam. Well, that's showing that there's a lot of protein in your urine. That's not a good thing. But also you may even see blood in the urine, which means that red blood cells are getting through, meaning your kidneys are really unhealthy. Another thing to look for is if you have a decreased amount of urination or excessive urination. This is also an indication that kidneys are in trouble. Now we're going to see muscle cramps because we talked about earlier that your kidneys are really important for maintaining sodium and potassium, and if your kidneys aren't working well, it's just dumping all your minerals, well, then you get chronic muscle cramps as well. Now swelling, okay? We're going to get puffiness around the eyes, and then something called pitting edema that will happen towards your feet and your ankles. And what pitting edema is if you press into your skin and then you take your finger out and you see a big old dent in your skin, well, that's pitting edema. So watch out for that. And then a decrease in appetite. So kidney problems are nothing to take lightly. So if you think that you are on the path of having some different kidney issues, certainly call your doctor. So I mentioned before that kidney disease is sharply on the rise. And if we want to know how we avoid it, it's very reasonable to ask the question, why? Let's talk about why. Now, first of all, obesity is an enormous problem. In the United States, it's estimated that 42% of people are obese, and this is continuing to get worse. I always think to myself, with people like myself and all the other people out there doing educational material, obesity, it's gonna go down because people have the answers. It's actually quite the opposite. And now that people were locked at home and are working from home, it's just getting worse. So if you're someone who's obese, you gotta start making strides to losing weight because, I mean, all the data shows that not only does obesity lead to more kidney disease, but it also leads to every other disease you can think of. Now let's talk about the next issue, high blood pressure. As I mentioned before, your kidneys regulate your blood pressure. And so not only is high blood pressure damaging to your kidneys, but an unhealthy kidney causes high blood pressure. So this is like a negative feedback cycle. And this is also something that many people struggle with. And then next is high blood sugar. So if you're someone who has insulin resistance and pre-diabetes, okay, it's estimated 100 million people are walking around with pre-diabetes and they don't even know it. So your kidneys are already getting wrecked as we speak if you fall into that category. So we got to keep the blood sugar low. And then of course, there's the type 2 diabetics that really need to watch out for this. And pretty much most type 2 diabetics are having their kidneys monitored because, you know, any doctor knows that this is a problem and we need to address it. Now, earlier I mentioned, well, the major medical establishments, they keep going, we don't know why this is happening. Well, here's a major problem. And I can tell you this is a major issue because I have my mother-in-law, she runs kidney dialysis clinics, right? This is where people, their kidneys completely fail them. They go in and have to get hooked up to a machine, and these machines filter their blood. It filters the waste from their body. Well, it's no way to live. Actually, it's quite horrible. And a lot of times when you're in this position, your quality of life just isn't good, okay? Well, there's a big thing that causes this that nobody talks about, and that's medications, right? And you might say to yourself, well, are medications that big of a problem? Yes, they are that big of a problem. They're synthetic, they're made in a lab, and people are taking way too many of them. Let's look at a few facts here that a lot of medical establishments fail to recognize. One is that medications have increased. Medication intake has increased 55 times between 1960 and 2010. Imagine all these people not taking medications, 55 times its increase. Wow, that's incredible. Now next is 55% of people take 4 medications on average. That is insane. And then also 39% of people take 5 medications or more, okay? So we have to look at this situation and go, okay, how do we naturally improve our health so we're not on all these medications that are destroying our liver and our kidneys and also our colon as well? And it's not just the medications, because a lot of people are taking over-the-counter drugs as well, and they think that, you know, there's nothing wrong with taking these. So I find all the time that patients will tell me, you know, hey, I don't have any problems. No, I'm not on any medications. Okay, you know, do you take anything? Well, I take about 1 ibuprofen a day to help me with pain. Whoa, are you kidding me? This stuff is wrecking your kidneys, your liver, and your colon. And then also the anti-inflammatories. A lot of people are taking those as well. So these things shouldn't be taken lightly. And this is when we really have to step up and find solutions to this problem. Now let's go ahead and talk about solutions, because that's gonna be the most important thing that we could understand today is what do we do about these issues and how do we prevent kidney problems? Well, first of all, let's start with foods, because foods are gonna be the most important change that you ever make whenever you're facing a health condition. It's the place to start. And so as we look to foods, there's a few foods that we don't wanna eat if we have toxic kidneys and poor kidney health. And these are gonna be foods that are high in oxalates, not good for the kidneys. First, we want to make sure that we're avoiding beans, grains, kiwis, spinach is one that we definitely want to avoid, almonds, and also beet leaves. Now, as we move into the foods that we should eat, we're gonna start with vegetables. And on our list of vegetables that are gonna be good for our kidneys, we're looking to cauliflower, onions, garlic, red bell peppers, and also cabbage. So eat more of these. And in general, cruciferous vegetables are typically pretty good in order to support good kidney health. Now there's some fruits that are also proven to have some beneficial components to them for your kidneys. We're gonna look to red grapes, cherries, strawberries, raspberries, cranberries. You may have heard cranberries before. It's like anytime anybody gets sick or has a kidney problem, it's always like drink cranberry juice because it's gonna help. So definitely cranberries is beneficial, blueberries, and then apples. Now, a few other foods you can consider too are going to be eating chicken, fish, good fatty fish is good for you as well, eggs, and also olive oil has been shown to be beneficial for your kidneys. After foods, there's a few vitamins that we can consider. Two supplements that I like to use in my practice are going to be one called K-Kidney, and that is just a good kidney support, a targeted organ support, and then also one called KDIR, which is specifically designed to help with fluid retention in the body. So those are what I like to use for vitamins. I'll put a link to them in the description below if you want that extra support. And then we're gonna look to lifestyle, because this is really important, all right? First of all, we need to follow a low carb diet. That's gonna help keep our blood sugar low, our blood pressure low, and it's certainly gonna help with any issue related to obesity. The other thing that we wanna do is drink plenty of water. We don't wanna find ourselves dehydrated all the time. That is something that's very hard on our kidneys, so make sure you're drinking an adequate amount of water. You wanna get regular exercise and do everything that you can to reduce stress in your everyday lifestyle. So those are the lifestyle changes you should make, and this all will really support the prevention aspect so that you don't have toxic kidneys and you don't face kidney disease at any point in your life. If you enjoyed this video, I think you'll really enjoy this video next.